let's talk about treatment. When someone is suspected of having a heart attack, they come to the emergency room.
Yep.
What do they do?
Yeah. Well, the first thing we do when people are announced that they're having discomfort, that they might be a heart attack, is they need an electrocardiogram. Sometimes that's done at home. So if you're living in an urban area, and I'm sure here in Israel where you have this fabulous system of coronary care units and the country is small enough, the emergency medical technicians, the EMTs, actually can take a cardiogram on you right in your own home and transmit it, over the radio waves to the emergency room or to the intensive care unit, where the cardiologist will look at it and say, well, this looks normal. But even if it looks normal, you could still be having a smaller heart attack. So we would, if the story is good and the patient looks like they smell like they could be heading towards a heart attack, we would still have that person brought into the emergency room. But there wouldn't be quite the, what should we say, all the red lights wouldn't be flashing as much and the sirens wouldn't be quite so intense as if, oh, wait a minute, this is a heart attack. This is a myocardial infarction evolving, happening right under our noses. Then, of course, we're going to do everything we can to get you as quickly as we can to the hospital. Usually, if it's done by the EMTs, the emergency medical technicians, we'll skip the emergency room. We'll go straight to the catheterization laboratory. But let's say it's less clear. It isn't obvious from the electrocardiogram, and many times it's not quite so clear, particularly in the beginning. You'll stop at the emergency room for another cardiogram. Sometimes we'll even do some blood tests to look for when the heart cells are damaged. There's a release of certain proteins and chemicals into the bloodstream from the inside of the heart muscle, and we can measure that, and that tells us, oh, wait a minute, there have been heart cells damaged here. Even if it's a small amount, it could be sort of like the rumbling of the volcano. There's about to be a huge explosion, but things haven't gotten quite so far.
So that could happen, that there could be release of these proteins, proving that there's heart muscle damage, even if the EKG is negative?
Absolutely. We see that all the time. And that's, actually that's good news, because usually it's a little tiny myocardial infarction, a tiny heart attack. But again, again, the volcano example or the iceberg example, right? The part that sticks up above the water is only a tiny fraction of what's under the water. And then so usually when we see that bump and the protein is called troponin, and it's it's part of the internal structure of the heart that enables it to contract the heart cell. So when we see that in the bloodstream, it means the heart cell has been damaged. Now, what makes it more complicated, and one of the things that's part of my research area, is that you can have injury to the heart without having a heart attack. So let's say you're in a car accident and you bang your breastbone against the steering wheel. You can actually hurt the heart and you'll get a bump in this same troponin value. But that's the job. We're going to admit you to the hospital. We're going to do tests. We're going to figure out, is this a heart attack? Oh no, this is something else. The heart was injured with something else. And when it's injured by something else, for example, a virus in the heart or by hitting the steering wheel, the heart recovers. Heart attack, the heart can recover also to some degree, but it depends upon how much heart muscle you've lost. You lose a great big piece of heart muscle, you're not going to regrow that. So the liver, as you know, the liver is remarkable. You can take a chunk of liver and you can regenerate a whole new liver. And they do that. Little kids who need it get a little piece of liver from their mother or their father and they grow a new liver. Unfortunately, the heart's not that good at repairing the damage. So you'll get a small repair, but you're not going to get the complete replacement of the heart muscle. So that's another reason to get in early, so that we stop the heart attack, so you don't have a huge amount of heart damage and scar tissue.
So if I understand it correctly, doctors like to say time is muscle.
Absolutely. The time is muscle. Every minute you're losing a little bit of your heart muscle when you have a blocked artery, and we want to open the channel, get the blood flow going back to those heart cells so that we stop the process.